There are now 4 confirmed cases of coronavirus in Australia as the international death toll rises to 41. 3 patients in New South Wales and 1 in Victoria have caught the deadly disease, which originated in Wuhan, China, according to 9 News, which said the figures would soon be confirmed by New South Wales Health. The patient in Victoria is a Chinese national aged in his 50s who flew to Melbourne on China Southern Flight CZ321 from Wuhan via Guangzhou on January 19. He became the first confirmed case of coronavirus in Australia on Saturday morning and is now in quarantined isolation at Monash Hospital in Clayton in Melbourne's east. 2 men, one in his 30s and one in his 50s, are being treated at Sydney's Westmead Hospital. The age of the 4th victim has not been confirmed. Earlier on Saturday, a baby was rushed from Sydney Airport to hospital for testing and was later discharged cleared of the virus. 5 people tested in Queensland since have been cleared. Another 4 people in South Australia are undergoing tests as a precaution, but the likelihood of having the virus is low, according to authorities. Officials expect more people will be struck down with the dangerous virus in coming weeks as it threatens to become a global pandemic. Prime Minister Scott Morrison released a statement on Saturday afternoon saying officials are now tracking down all passengers who took the same flight as the man infected in Melbourne. The A380 plane, which can carry 500, arrived at Melbourne's Tullaramine Airport around 9:25 am on January 19. Mr Morrison also announced the federal government has stepped up measures to protect Australians from the virus, along with a dire warning to not travel to China's Wuhan or Hubei provinces. From today, Saturday, anyone arriving in Australia on flights from other parts of China will be met and provided instruction on what to do if they have symptoms that start to develop them. Mr Morrison's statement read, Chinese authorities have also imposed travel restrictions in at least 5 cities in the Hubei province. Australians travelling to these areas may not be able to leave until restrictions are lifted. Mr Morrison added the federal government will continue to monitor the situation and take action when necessary. In Melbourne, many CBD pharmacies are running out of protective face masks, which were already in huge demand due to the toxic haze from the state's bushfires that blanketing the city. I have been to 9 pharmacies already, they're all out of them, a Royal Melbourne Institute of Technology student originally from Shanghai told Reuters. And I need them, we all need them. However, health officials say the masks are not recommended. Face masks are not recommended for use by members of the public in Victoria for the prevention of infections like novel coronavirus, the Victoria Health Department said in a statement. Victoria Health Minister Jenny Mikakos told reporters on Saturday that the infected patient had been in Wuhan, the epicentre of the outbreak, for 2 weeks by himself. He was confirmed as positive after a series of tests early this morning, Ms. Mikakos said on Saturday. Ms. Mikakos said it was possible the man wasn't contagious while on board as he didn't start showing symptoms until after arriving in Melbourne. We are now in the process of making contact with all the other passengers on the flight, she said. It is important to stress that there is no cause for alarm to the community. In Queensland 6 people, including 3 from the Gold Coast, were being assessed for the virus, 5 of whom have now been given the all-clear. 4 others in Queensland were given an all-clear earlier in the week. New South Wales Chief Health Officer Kerry Chant said 2 men with the virus in Sydney were not particularly unwell but were being kept in isolation at Sydney's Westmead Hospital. Both had travelled to China recently. As far as I know, they were not on the same flight, Dr. Chant said. The risk of transmission is still very, very low. But we felt it was prudent to take this precautionary approach. They are 2 of 6 people being assessed in New South Wales, with 2 others cleared on Friday. The Department of Foreign Affairs and Trade overnight raised the level of travel advice for Wuhan and Hubei province to do not travel. The disease is listed as having pandemic potential, allowing border measures to be enhanced. The confirmation today by Victorian authorities of the coronavirus case was a matter that had been anticipated, Mr Morrison said. The Australian government is of course taking this issue incredibly seriously. Australia's Chief Medical Officer Brendan Murphy said it was important for people arriving from Wuhan, and those in close contact with them, to monitor for symptoms including fever, cough, sore throat, vomiting and difficulty breathing. Experts are still learning about the virus. We don't know exactly how long symptoms take to show after a person has been infected, but there is an incubation period and some patients will have very mild symptoms, Professor Murphy said. China has confirmed 41 deaths from the virus, while more than 1,000 people are now estimated to have been affected worldwide. Cases have been confirmed in 10 countries.